2024 was a really challenging year for digital health founders. I think not in any near future that I can envision will AI completely replace doctors. Not all solutions need AI. This is something that a number of startups are really grappling with. Consumer preferences are becoming more selective, that there'll be a lot of tension and competition in this space. I think the whole process is false, but in certain areas it's true. When users understand how AI is working and the risk is low, it's going to be a much easier, faster path to adoption.
Hi, and welcome to our new episode of Digital Health Interviews. You can see with my ugly Christmas sweater that today is our holiday edition and our last episode of this year. So we're going to discuss 2024, look ahead at 2025, and learn a lot of insights and hopefully get some predictions. Before we actually get to our interview, I want to give you some stats of our YouTube channel over the past year. So we recorded 14 interviews. Obviously, we had 11 monthly digests. December digest is still coming. And a lot of educational videos as well. So far we had 243,000 views over the 2024, which is really exciting. And now I'm really happy to introduce our today's guest. Her name is Julia Croxen. Hi, Julia.
Hi, Alex. How are you doing?
I'm doing really well and excited about our conversation.
Yeah, excited to be here, excited to chat with you today.
Let's start with your intro. Please tell us a bit about yourself.
Yeah, my name's Julia Croxen. I'm a principal at Rock Health, which has been focused exclusively in the digital health space for over a decade now. I specifically work on our consulting team, so primarily supporting enterprise clients with their digital health and healthcare innovation strategies and implementation.
As we close out the 2024, can you give us your assessment of the current state of digital health industry?
Yeah, definitely. I think it's even more useful to look a little bit further back to 2023. So if you think about 2023 as kind of the year of market correction in digital health, it's helpful to context set what we've seen in 2024, which is a bit more of a disciplined growth mindset, especially when we think about activity among investors and the startups that raised funding across the last year. Our latest funding report was for Q3. We're still crunching the numbers and we're still looking to see if deals come in to close out the end of the year. But as of Q3, we had seen $8.2 billion raised across about 379 deals. Based on where we are right now, we predict that at the end of the year, we'll be around or slightly below what we saw in terms of investment in 2023, which ended the year at around $10.4 billion. We've seen a shift towards early stage deals, while we've seen mega deals kind of remain a bit steady in general. The kind of growth has been greatest in the Series B category, which is somewhat surprising. We've also seen across the course of the year, kind of quarter over quarter, the total number of deals decline, but the average deal size remain fairly consistent and steady, which we think indicates investors are taking less, more focused bets in terms of where they're placing their funding dollars.
We're going to talk about trends in investment later on, but why do you think there's this focus on investing more early stage?
I think to some degree, the later stage companies have kind of seen really high valuations. And we're also starting to see the need for mindsets to shift from what historically had felt like growth at all costs to more of this sustainable and responsible growth mindset, where it's as important to grow and scale as it is to be on a path toward clear profitability. And I think a lot of later stage companies are grappling with how do we achieve that and how do we pivot. It can also be harder to make that pivot when you're already a large organization that's raised a lot of money at a high valuation.
Right. So you mentioned the funding report is coming in January, but recently Rock Health published another report, Innovation Maturity Curve Report. So tell us what were the biggest surprises for you in that report?
Yeah, so we had seen a trend at the end of a year with folks kind of making predictions about the year ahead. And we kind of, as an organization that's really entrenched in research in the digital health space, wanted to bring a way of thinking about innovation with a data-driven mindset. So we developed Rock Health's Innovation Maturity Curve, which basically relies along data-driven metrics associated with research activity, investment dollars, and partnership activity to help understand the relative maturity of different types or categories of innovation in digital health. This was our second year publishing the report, and 3 of the innovation areas we looked at were areas that we repeated from last year. So it's a bit interesting to look at the trends year over year, and then 3 of the areas were net new. One area we looked at was AI in healthcare, which I'm sure we'll talk about a bit later on. Interestingly, it didn't move along the maturity curve to the next category class. So we still see it as being kind of quote unquote developing in terms of where it is. Some of that is due to really just the proliferation and diversity of use cases that are still emerging and being explored as it relates to AI in healthcare. We also looked at digital obesity care, which I'm sure has been top of mind for everyone with the kind of discourse around GLP-1s today. That definitely kind of moved up along the maturity curve. We've seen a lot of startups emerge, a lot of interesting solutions, and kind of start to begin to seek to scale as well. The most surprising to me was actually food as medicine, which was the most nascent area we looked at in 2023, but has really expanded and I think is one of the areas that I predict will really continue to kind of develop and evolve and mature in the coming year, especially because we see it being a key focus for RFK, who is the nominee for leading HHS under the upcoming administration, and he's really kind of hammered in on the importance of food as it relates to health in the United States. In terms of the new areas, we looked at patient phenotyping and digital health. We looked at wearables that are of more innovative form factors beyond wrist-worn or ring-based, and then we looked at climate health innovation. The last was overall the most surprising. It's also the most nascent. It's something that I personally hadn't heard at all before this year and seems to just be emerging. I will say that the kind of outgoing administration in White House has done a lot to bring climate health or the implications of extreme weather on health to the forefront. So I'm interested to see how that will be impacted by the transition to the new administration, because our take is that there's still a lot of foundational elements that would need to be put in place for it to be able to continue to mature along that innovation maturity curve.
Can you give us an example or a few examples of climate health innovation solutions?
Yeah, so when you think of some examples of climate health innovation solutions, you can think of, for example, solutions that help to flag warnings about air quality for wildfires, which can be really devastatingly impactful to patients with respiratory conditions, asthma, COPD, etc., and really exacerbate them. There's some solutions that will give warnings to those patients based on integrating data from local weather reports that help them be aware that that's a risk in their local geography. So that's just one such example.
Very, very interesting. Since started asking about examples, can you give us a few success stories of 2024 where you think the startups navigated the challenges of the year real well?
Yeah, 2024 was a really challenging year for digital health founders. I think it would be naive not to acknowledge that and not to acknowledge how significant it was for startups and founders to find success in this environment. There's one theme that we saw as quite kind of a path to success that we saw certain startups take. And this is something that we actually spoke about in our most recent funding report. And it's this idea of, we kind of called it tapestry weaving, where startups are using M&A in order to expand their capabilities and service offerings into something that's of broader value to their customer base. We've seen Dario Health do this. We've seen Commure do this. We've also seen Fabric Health do this. And I think that latter example is one of the most interesting because it's an example of a relatively earlier staged company doing this, in that Fabric Health was founded in 2021. And then from 2023 to 2024, we saw them make 4 acquisitions in order to expand beyond what was their historic core capability set of offerings focused on emergency room efficiencies to add on solutions from Zipnosis, Giant, MeMD, and Team Health that are all distinct but complementary capabilities and features that make the overall offering more attractive and also provide an opportunity to introduce new revenue streams to the business as well.
Let's talk about the impact of the pandemic for a sec. I do think it reshaped healthcare in many different ways. What's your take? How do you think it actually impacted the technology adoption?
I think sometimes we forget about how significantly COVID reshaped healthcare and really spurned digital health. You can just look at the funding data to see the boom starting in 2020 and then into 2021 in terms of the acceleration of investment in the space. I do think there's a lot of impact as it relates to behavior change among decision makers, providers within healthcare more broadly, greater interest and openness in innovation, technology, adopting those types of solutions. It was necessitated by COVID. It was really a forcing function. But I think that need to get creative and to problem solve in an environment of necessity has continued on to some degree. I think we've seen some innovations reach an equilibrium point, and they are kind of at a place of stability and maturity. Telehealth, virtual care is one of those. For the last 3 years in our consumer adoption research, we've seen fairly consistently that about 75% of consumers have indicated use of telemedicine. What we're starting to see, though, is that consumer preferences are becoming more selective in terms of what they desire to use telehealth for versus what they would prefer to be going in person to see a provider. And so there's starting to be that maturity in consumer behaviors there. I think there are some areas that COVID really put an emphasis point on and exacerbated, and we're still seeking solutions out to address in terms of unmet needs. One of those is provider burnout. Another is really thinking about the impacts of patients not being able to or avoiding preventative care early diagnosis and having that lapse in care that has resulted in conditions being caught or addressed later than they may otherwise. And I think those are two areas that are still ripe for solutions and innovations. And really, some of the unmet need resulted from the pandemic itself.
But from what I hear, you're still pretty optimistic that this change for technology adoption will stay with us, right?
Yeah, that does seem to be the trend. We've seen more and more providers, payers stand up innovation arms, put in place some of the foundational elements required to intelligently assess and evaluate digital health solutions and ultimately think about how to adopt them not only as an organization and an enterprise, but ensure that that actually reaches the target end users, whether that be frontline providers and nurses or care or case managers amongst a payer population health stakeholders, or even their patients or members.
All right. All right. You mentioned the boom of investment 2021.
Yep.
And lots of companies raised really tons of money with inflated valuation. And again, I think right now a lot of them are really struggling. Most of them need more capital, and VCs are not really willing to give at that valuation now. So what's happening, or what's going to happen with these companies? And if you were a strategic advisor, maybe you are, I don't know, to one of them, what would you advise them to do?
Yeah, so I think it's fair and it's accurate to say that this is something that a number of startups are really grappling with, how to raise funds with the valuation that they received during 2021, early 2022, etc. One trend we've noticed is unlabeled rounds, which is a way in which sometimes can be used, at least as a way in which startups can raise additional funds, extend their cash runway, when they might not have reached the milestones necessary to raise the next labeled round. It also delays kind of down rounds if that's something they might be facing.
They're raising from their previous investors, most likely, right?
Mostly from their previous investors, sometimes including new investors in the mix. But yes, that's accurate. What we see most often is companies looking to make that shift I mentioned earlier from a growth at all costs mindset to sustainable growth or path to profitability. The most common tactic we see startups taking is looking to identify as many operational efficiencies as possible to reduce their cost structure while doing everything they can to maintain or even ideally grow their revenue. That's a pretty challenging path, and it's also hard to continue to grow to reach the size to support the valuation. One idea that we would suggest startups and founders consider is the idea of tapestry weaving. Are there opportunistic acquisitions or mergers you could execute that increase the value to your buyer targets, introduce new revenue streams, help you to continue to grow and scale to achieve a size that supports the valuation you formerly raised at? And then I think lastly, it's important to just recognize that not all companies will be successful. We do expect that a number will shutter over the coming months and year, and that's something that we've even already started to see to some degree in the digital health space if we look at the last few months as well.
All right, let's finally talk about AI. Hype versus reality. From your experience and your personal understanding, do you think the AI adoption, especially with the Gen AI tools, will be much faster than any other technology in healthcare, or is going to go the same path? I don't know. It's telehealth, which took 60 years to be adopted?
Yes, AI is definitely top of mind for everyone in the healthcare space and beyond. And I think Gen AI solutions have really brought it to the forefront of society as a whole. I do think that on average, we're seeing greater interest and adoption in AI tools compared to other categories of technology solutions when we look historically. At the same time, I don't think you can make a blanket statement about AI. Just because there is such variety of use cases, applications, type of AI that's being explored in the context of healthcare. In terms of that speed of adoption, I think it really comes down to two things. I think it comes down to the degree to which the user understands how the AI works versus the degree to which it feels a bit like a black box spitting out an output, and the risk associated with the application. Inherently, when users understand how AI is working and the risk is low, it's going to be a much easier, faster path to adoption. This is some of the more automation, administrative, non-clinical workflow type use cases. I think the one everyone has heard about is AI scribes for note-taking in the context of clinical care. On the flip side, where there's use cases or applications where exactly how the AI works might be unclear, at least to the intended end user, and the risk of the output is higher, such as clinical decisions, clinical recommendations. Those, I believe, are use cases where we'll see relatively slower rates of adoption and much more caution and guardrails put into place. And I think to some degree that's responsible in the context of healthcare.
From the investor perspective, can you tell us what investors think when they hear a pitch deck and start a founder? Oh, we have this AI component to the whole product.
Yes, I think one point of caution for founders is to be focused on the challenge and the solution, as opposed to just using AI as a term to generate excitement. Not all solutions need AI, and making sure that it makes sense for the solution in the area you're focused on for the solution to be AI is important. AI can be expensive, and that's something to keep in mind as well, is the cost associated. I also think it's important to think about, is your AI solution something that has a sufficient competitive moat in a place that makes sense for a startup and a likely early stage startup to enter the market? Or is it more of a solution that we would expect a more established incumbent type player, such as the big tech companies even, to be pursuing and successful in, because it will be much harder to compete against them compared to other early stage startups where there's a reason or necessity that you as a founder and your company are uniquely positioned to bring this AI application or technology to market.
They're very insightful. Thank you. Now, I want to play a small game with you.
Okay.
So we have true and false statements. I'm going to read you a statement, and you can choose and show us if it's true or false. And if you want, you can comment why you made the decision, or we can just move forward. Let's start with the one that a lot of hype and everybody's talking on X at least. AI will replace doctors.
I'm going to say false.
Never?
I think not in any near future that I can envision will AI completely replace doctors. I think there will necessitate a need for human in the loop when it comes to clinical decisions for quite a while. Over time, there may be an increasing role of AI in terms of providing recommendations, but I think it will take quite a while until we don't have a human in the loop to review and validate the AI recommendations.
All right. The next one, we reached the same amount of investments in the healthcare industry as we saw in 2021 already in 2025.
I think that's false. I do think that the market recalibration has seen caution or has resulted in more caution among investors. We've seen fairly consistent funding across the last 2 years. That's much more in line with 2019 and 2020 than 2021 or 2022. So I do expect that trend to continue. An open question in terms of how the new administration will impact both the macro environment as it relates to funding and availability of capital, as well as impacts on the digital health sector as well.
And regulatory, probably.
Yes.
All right. The next one is home-based care will become a new norm in the next 5 years.
True with a caveat, I think it depends on exactly the type of care we're talking about, but I do think we're already starting to see this become a trend in certain spaces. The idea of aging at home, the idea of remote patient monitoring, hospital at home where a patient may have only been at a hospital to monitor their condition in case of an adverse event. I think some of the rehabilitation type care, we are already seeing that transition to a home setting. I don't think we'll reach a place where all care is delivered at home, but I think in certain spaces it makes sense and we're already seeing it.
All right. I love that. The next one is digital solutions. Digital solutions and remote patient monitoring devices will dramatically improve the whole process and quality of a clinical trial.
I think the whole process is false, but in certain areas it's true. It's a bit of a balancing act. I think digital solutions and remote patient monitoring devices ideally will enable greater ease of participation, recruitment, access to clinical trial involvement. I hope that continuous monitoring via remote patient monitoring solutions will allow for faster generation of signal as to whether or not innovations are effective, and that could result in the need for less participants in trials or the speed of trials to increase. So I do think there's ways in which clinical digital solutions and remote patient monitoring will result in efficiencies and better experiences. I don't think it'll impact all facets of clinical trials.
A complete switch from fee-for-service model to the value-based care will never happen in this country in the next decade.
I think true. I think we've been talking about value-based care for quite a long time. I think we're starting to see indications that certain areas will transition and it makes sense to transition to value-based care. I think fee-for-service is so entrenched in our healthcare system that I would be surprised if in the next decade we see a complete switch across all service lines and types of care being provided.
And the last but not least, I talked to a lot of doctors and patients, and one of the big problems a lot of people are telling me that they have too many apps to track different biomarkers, different diets and stuff like that. So as doctors, in order to track the health record, you need to use multiple apps. So the statement is someone comes up with a super app that combines most of the solutions in one and provides one point of entry for both doctors and patients?
I think that's true. I don't know that it will happen in 2025, but you didn't give me a time frame on that one. But I do think we are seeing what we call as point solution fatigue across the board. It's something that's frustrating to payers and employers. It's something that, to your point, in talking with providers and patients, is resulting in a challenging experience within healthcare. And I do anticipate that over time we'll start to see platforms become winners in this space and other solutions start to serve as plugins to that context. And I think that the number of plugins to some degree will expand over time and the user experience will feel much more integrated for both patients and providers.
Kind of to follow up that thought, do you think one of the big tech companies will come up with that super app, or there is a chance for a new startup to do that?
I think there'll be a lot of stakeholders vying to be that super app. I could see ambition of big tech players. I could see ambition of the various payers to become that super app for their respective members. I could see a world in which it is a startup. I think it would be a bit challenging just because you're trying to become the overarching backbone. But it is possible. I think important to acknowledge that there'll be a lot of tension and competition in this space to own that super app and kind of the patient journey.
I agree. Looking ahead, what will define digital health in 2025?
I do think mental health and AI as kind of respectively clinical indication and type of technology will be mainstays in terms of garnering significant investment. Mental health was the top funded clinical indication through Q3 of this year, continuing its reign for the last 5 years or so. And AI solutions or companies that had some level of AI enablement garnered about 30% of funding in digital health. So I don't really anticipate that to change. We have seen some shifts in terms of cardiometabolic, led likely by obesity and weight care, as well as women's health, led by reproductive and maternal health, kind of grow in terms of their relative investment and ranking, if you will, among clinical indications. And I think both of those will continue as trends in the new year, driven by both GLP-1s, consumer desire for weight management solutions, and then in the women's health space by some of the policy and legislative pushes, as well as, again, that's an area where we see a lot of significant consumer demand. So I do anticipate those to be hot areas in 2025 as well.
I know still most of our audience are startup founders early stage in digital health. Your piece of advice looking ahead of 2025, what would you recommend them to do or not to do to be successful and sustainable?
Yeah, I think it's a balancing act. I think it will still be important to have big ideas and be led by innovation, but it's equally important, more so this past year and looking forward, to be extremely practical in your approach and implementation, really thinking through product market fit, your business model, your go-to-market strategy, regulatory and evidentiary requirements to achieve success, and really having that be a balance as you both seek investment and bring innovations to market.
This is great. Thank you, Julia.
Great.
Hopefully 2025 is going to bring us lots of great news in digital health space.
Yeah, I'm excited to see what comes to fruition, and it's great to chat with you.
Thank you very much.